Hello, my name is Dr. Raj Chovatiya, and I'm Assistant Professor of Dermatology and Director for the Center of Eczema and Itch at Northwestern University Feinberg School of Medicine. Now, many patients with atopic dermatitis still do not have adequate control of their disease, and this underscores the need for additional safe and efficacious treatments. As our armamentarium of topical and systemic therapies for atopic dermatitis becomes richer, so is going to be the individual shared decision-making conversations that accompany each potential treatment option. This is probably the most fun part of what we do in dermatology. Now, JAK inhibitors, in both topical and oral form, are one of the new, exciting classes of targeted therapy for atopic dermatitis. Recently approved medications in this class include topical ruxolitinib and oral upadacitinib and abrocitinib. All of these medications are small molecule inhibitors of the Janus kinase family, which is composed of JAK1, JAK2, JAK3, and TYK2. Each molecule shows slightly different selectivity for each of the four JAK proteins based on preclinical studies. One important differentiator of the JAK inhibitor class to previous therapies is how they work to reduce the inflammation that is associated with atopic dermatitis. Biologic medications like dupilumab are composed of antibodies that bind to and block specific receptors on the outside of the cell, thus preventing cytokines from communicating pro-inflammatory signals. JAK inhibitors, on the other hand, inhibit important upstream signaling proteins that are found on the intracellular portion of these receptors. These are the JAK proteins. Now, the JAK proteins bind in different combinations to a variety of different receptors and essentially function to link the information on the outside of the cell to changes in transcription on the inside of the cell. This is how the JAK inhibitors appear to be so effective at targeting multiple inflammatory signals as opposed to any one specific pathway. However, this is probably also the reason why there is broader risk of certain adverse events when it comes to using JAK inhibitors.